Hi, welcome to Detours, Understanding Acquired Brain Injury. This is Genes and Chromosomes, Unit 4, Chapter 2. Medical Professionals Study Genetics. Most everyone has heard of the certified genetic counselor, but there are other medical professionals that study genetics. Now, there are physicians and advanced practice providers, that is, nurse practitioners and physician assistants, that study genetics specifically. Now, highly specialized physicians and advanced practice providers that focus specifically on genetics and how it affects the health of patients. When it comes to a physician or an APP of any sort, they can order genetic tests. But if a patient wishes to have an in-depth assessment to look for potential genetic disorders, or a woman is pregnant with a baby and is concerned, then she needs to turn to a specific type of physician. And we're talking about MDs or DOs here, about specialist physicians who've done further training. This physician is called a clinical geneticist. So if you're dealing with somebody, a clinical geneticist, they have a license to practice medicine first, an MD or a DO in the United States or Canada, but their focus is the practice in genetics. A clinical geneticist applies knowledge of genetics to educate and in some cases treat patients with genetic disorders using tools of genetics. Clinical geneticist is interested in how genes affect health. The clinical geneticist can order genetic or other medical tests. They can prescribe medications, of course, and they often lead research teams. A clinical geneticist is usually found in large university hospitals, level one trauma centers, and the big medical institutions. They also may practice on their own in smaller hospitals and smaller medical research hospitals, as well as practice for companies that are pharmaceutical companies and companies that do research into genetics, as well as they may teach at medical schools or places that teach certified genetic counselors, things like that. But usually they are team lead as well, because they have such a broad-ranging specialty. So many clinical geneticists or medical geneticists, which is the other term you may hear to describe this type of physician, they're typically what's called a scientist practitioner, which means they do a lot of lab research, but they also will work with patients with genetic disorders. They'll do things like experiments in regenerative medicine, for example, working on regrowing body parts or regenerating lost tissues, things like this. That is a domain of a clinical geneticist as well. They educate other medical professionals, families, patients about genetics, treatments, and they're the kind of physicians that develop these tests too. They have a very broad-ranging understanding of genetics. Their focus is not specifically on diseases alone. They understand the gamut. They are kind of the leaders in the field. Clinical geneticists first must complete a residency in something like internal medicine or family medicine. Then they'll take a fellowship. So they first will complete, after medical school, a few years doing their residency. Then they'll take their fellowship, which is about 2 years in genetics on top of that. Then they will go and take an examination by the American Board of Medical Genetics and Genomics, who gives them a test, and they become certified as a specialist as a clinical geneticist or medical geneticist. Then they practice after that, and that's how and they become the certified clinical geneticist. Then there are the APPs, advanced practice providers, the genetic and genomic nurse practitioner. Genetic and Genomic Nurse Practitioner is an APP that's completed a doctorate in nursing practice. They've received extra education specifically in genetics and genomics, usually through either a formal residency or medical center or through practice with somebody who's been certified or through a lot of self-study. They have to take a specialized board examination as an Advanced Genetic Nurse Practitioner, or AGN-BC. Depending on the state in which they practice, they either are supervised by a clinical geneticist or by a physician who's a specialist in genetics certified in another way. Genetic and genomic nurse practitioner, just like a clinical geneticist, may prescribe testing, medication, may order treatments for various disorders. Genetic and genomic NP typically will assist in research, education, ordering tests. They'll help typically a clinical geneticist. This whole field is brand new, so a lot of things have not been clearly defined yet. Many genetic and genomic NPs perform patient education. Now, these are the kind of specialists that have prescriptive authority, admit, and will engage in attempts to treat as we're developing new tools to treat genetic disorders. But the certified genetic counselor, for example, it does not have the authority to write prescriptions or to do. Their specialty is a little different. Let's talk a little bit about them. A certified genetic counselor has typically a Bachelor of Science in biology, chemistry, or an allied health field, perhaps nursing or physical therapy or something like that. They then must complete a master's degree or doctoral degree in genetic counseling, specifically, which includes courses in molecular genetics, ethics, education, clinical genetics, and research methods. When they complete their master's or doctoral degree, then they sit for a licensing examination from their state. Most states require a certain number of hours of practice before allowing the newly graduated professional to sit for a state license. Then many of these licensed specialists, to demonstrate mastery of their craft, or they take a certification examination from a national board which is established by their fellow professionals to demonstrate that they have skills beyond simple licensure. Certification exams of any sort, especially in medicine or nursing or therapy or whatever, are very difficult to pass. And many employers require certification on top of licensure to demonstrate high skill levels. Just as a side note, state licensing is mandatory in order to practice at all. And then the certification just adds that. Certified genetic counselors pass the national certification examination to become a certified genetic counselor. There are then subspecialty certifications such as oncology or genetic neurology or cardiac genetics, metabolic genetics, prenatal genetic counseling, just to list a few of the most common specialties. Genetic counselor may study and test to receive then further subspecialty certifications within each of these domains. American genetic counselors receive their certification from the American Board of Genetic Counselors. Now, obviously, other countries have their own certification process. In many states, a certified genetic counselor must have what's called a collaborative agreement with a clinical geneticist or other physician that studies genetics. This collaborative agreement defines what privileges the certified genetic counselor has in relation to their domain of practice. So, can they write an order to give you a genetic test? Can they interpret these tests on their own? May they make a diagnosis? In some states they can. Not most, but in a few states they can actually make a medical diagnosis. But this normally is restricted to physicians. So they would need any kind of orders for that written out in this special collaborative agreements. Some certified genetic counselors own their own practice, or they work with independent medical practices. Some teach at universities and they engage in research. The primary practice difference between a clinical geneticist and genetic counselor is that genetic counselor is an expert in techniques for testing, interpretation, and a clinical geneticist or medical geneticist is focused on the whole picture from soup to nuts in relation to testing, treatment for genetic disorders. Clinical geneticists always would lead the team at the hospital for, say, genetic disorders or developmental disabilities at a children's hospital, something like that. Whereas a certified genetic counselor will be involved in interpreting or analyzing stuff like that. Ordering medical testing is considered the practice of medicine in most states, so must be authorized and signed by a collaborating physician unless this is allowed by state law or permitted in the collaborative agreements. Again, in some states, a certified genetic counselor may make a very narrow medical diagnosis, but this is, So the scope of practice is very narrow and defined by their collaborative agreement. Now, there are genomic pharmacists, too. The genomic pharmacists are kind of a new thing. There have been those who've done research, but to be this kind, they study how genes and medications interact, as well as the uses of biopharmaceuticals, such as small RNA segments, custom engineered viruses, or protein sequences to alter mutations in genes back to the wild DNA type as opposed to abnormal or pathological DNA which may be present. So licensed pharmacists in the USA typically have what's called a PharmD or Doctor of Pharmacy. So they complete 3 or 4 years in pharmacy school after getting their bachelor's, and then in these cases they usually will either go for further certifications in genetics and will take certification examinations, or they will take a residency, a 2-year-long residency in genetics, and focus on and become clinical pharmacists, where they will assist physicians in choosing proper medications of the genetic sorts. They will choose medications that are compatible with patients' genetics. They will make recommendations. They will help with the design and development of new medications that assist in treating genetic disorders. Again, a genomic pharmacist, this is a new discipline in pharmacy. But yeah, and there are some pharmacists that have prescriptive privileges in a growing number of states. But remember the term clinical pharmacist. We will talk about different specialties later past this series, but just so you're aware, pharmacists who wish to become clinical pharmacists, this is extra time. Such pharmacists typically work with clinical geneticists. They'll work with biogeneticists who have their PhD in genetics. They're advanced, well-trained biologists who are specialists. These are just some of the specialized genetic medical professionals out there that help patients and their families with their genetic diseases and disorders. Obviously, as we learn more and more about genetics, we will see more and more specialists in the field of genetics. We'll take our break here, and we will come back next time, Unit 4, Chapter 3, and where we will talk about some of the genetic testing. So, hope you found this interesting and helpful. Talk to you later. Bye.